Hi there, I'm Jack.
And I'm Lisa.
We are a couple of final year dental students, and we are on our way to a dental practice to interview Haley, a dental therapist. We wanted to create this video to educate other final year dental students on the role of a dental therapist within various dental and healthcare settings. Also, how they can cooperate with other team members to improve patient care. I'll just message her now and let her know that we're almost there.
Hi, I'm Haley. Welcome to my dental practice. Do you mind if we do the interview here in the waiting room?
Hi Haley, thanks for having us. I'm Jack, and this is Lisa. And if it's okay, she'll be recording this interview so that other final year dental students can watch this. Shall we begin?
Of course, that's fine.
3, 2, 1, action. So Haley, maybe you could start by telling us what exactly is a dental therapist?
Dental therapists are registered dental professionals who are part of a multidisciplinary team. We carry out certain items of dental treatment direct to patients or under the prescription of a dentist.
What do you mean by a multidisciplinary team?
A group of professionals from one or more clinical disciplines who together make decisions regarding recommended treatment or individual patients.
I see. So a dental therapist must be a relatively new role then.
Dental therapists have actually been around for almost 60 years.
Really?
Yes, in the 1950s, there was a desperate shortage of dentists in the school services, and children's dental health was worsening. As a response to this, in the 1960s, the first school for training was opened at New Cross Hospital in southeast London. Dental therapists were known as dental auxiliaries at this point. They were trained to do restorations, extract deciduous teeth, give infiltrations but not IDBs, radiographs, and scaling. The Dental Act only allowed therapists to work in hospital and armed service settings. In 2002, the Dental Act was reviewed to allow therapists in general dental practice. Their scope of practice widened and were now trained to do IDBs, pulpotomies, and impressions. In 2004, the first dental therapy course commenced in Scotland, which took place in Dundee. In 2013, the GDC introduced direct access to dental therapists, which means a dental therapist can carry out their full scope of practice without prescription from a dentist and without a patient requiring examination from a dentist first. However, due to the fact that therapists aren't able to retain an NHS performer number, direct access can only be obtained on a private basis. In the future, direct access may be available on the NHS, but only once legislation has been passed by the government.
Wow, I didn't realize there was so much history about dental therapists. So, what is in a dental therapist's remit?
According to the GDC, I can carry out clinical examinations and oral cancer screening, periodontal examinations, I can diagnose and treatment plan within my competence, and prescribe radiographs. I can provide preventative oral care and liaise with dentists. I can undertake supragingival and subgingival scaling and root surface debridement. I can adjust restored surfaces in relation to periodontal treatment, apply topical treatments and fissure sealants, and I can give infiltrations and inferior dental block analgesia. I can place temporary dressings and re-cement crowns with temporary cement. I can also restore primary and secondary teeth. I can carry out pulpotomies on primary teeth. I can extract primary teeth, and I can also place preformed crowns on primary teeth.
Wow, that's interesting. I didn't realize a dental therapist's scope of practice involved all those things. Maybe you could start with the comparison of NHS versus private dental care.
Sure, NHS dental care is subsidised or paid for by the NHS depending on the patient's circumstances. For example, if the patient is exempt from paying dental fees, the NHS will cover the whole balance. Regulation and addition to treatment are set by the NHS with the aim to provide functional and preventative dental care. Therefore, the treatments that are available are restricted to those which are deemed essential. For example, tooth whitening is not deemed essential and it is for aesthetic purposes. Patients can also access dental care on a private basis. Private dental care is not regulated by the NHS in any way. These practices generally follow a treatment plan according to evidence based dentistry with no specific guidelines or rules set by a governing body such as the NHS. Fees for treatment are set by individual practices, but these are usually influenced by the socio-economic status of the area. Therapists can work both under the NHS or privately. This usually depends on what type of setting the dental therapist is working in.
So, what is a general dental practice then?
A general dental practice are practices that are usually found on a local high street and within local communities around Scotland. These businesses are set up by practice owners and income is generated by patient payments, whether that be NHS or private, as well as subsidies by the NHS if there is an NHS contract in place. Commonly, clinicians such as dentists and dental therapists are self-employed and support staff, such as dental nurses and receptionists who are employed. Another service in Scotland is public dental services. These are an amalgamation of community and NHS salary services. They can provide care to patients who are otherwise unable to access dental care in general dental practice. These can include special care patients and extremely phobic patients. Only NHS treatment is available in the public dental services, and patients will pay for their NHS treatment unless they are exempt. Staff including dentists, dental therapists and dental nurses are employed directly by the local health board on a salary basis.
I see. What about utilising dental therapists within these settings?
Dental therapists are able to work in both primary and secondary care settings depending on the requirement.
So, what is primary and secondary care?
Primary dental care is routine dental care carried out at an NHS, private or public dental centre. Secondary dental care is on a referral-based treatment which is carried out in a specific centre. They both go hand in hand together. Therapists are becoming increasingly common in general dental practice. As dental practice become busier, dentists may wish to increase their advanced restorative work, and a dental therapist can be utilised to take over the more routine care such as simple restorative work and prevention. A dental therapist can also work under direct access, meaning they can see a patient on a private basis without a prescription from a dentist. This allows the therapist to utilise their full remit and it gives the patient more freedom of choice. This again allows a busy practice to prioritise more complex procedures to a dentist. Dental therapists are now able to own their own dental practice, and within public dental services, therapists can work salaried as a band 6. Their role within public dental services can include treating patients in surgery, visiting housebound patients, visiting care homes, oral health promotion, fluoride varnish in schools, epidemiological studies, VT training and tutoring.
Great. What about nationwide health improvement projects? Could you tell us a little more about that?
Yes, therapists have a vital role within the different ways in which dentistry is provided in Scotland, including within multidisciplinary teams and nationwide health improvement projects. In terms of oral health, Child Smile is a key campaign designed to improve the oral health in children across Scotland. The role a dental therapist can play includes coordination of Child Smile activities within a local health board area, supervised extended duty dental nurses and dental health support workers undertake fluoride varnish application and meeting with external health care workers such as health visitors to educate and increase awareness of the campaign. Dental therapists can also have a role in the National Dental Inspection Programme, or NDIP for short, and this is an annual inspection. NDIP was developed in 2002 and undertakes detailed epidemiological examinations of a random sample of Scottish school children in Primary 1 and Primary 7. A dental therapist can examine the children and record their findings under NDIP. They are then used to monitor the impact of local and national oral health improvement programmes such as Child Smile and to assist in the development of dental services throughout Scotland.
Interesting. Are there any more?
Yes, Caring for Smiles is another one. Caring for Smiles is Scotland's national oral health promotion, training and support programme which aims to improve the oral health of older people, particularly those living in care homes. The training has been developed for care staff, nursing staff, oral health champions and care home managers. Caring for Smiles team provide basic training sessions to improve the delivery of oral care.
Why was it developed?
It was developed because in 2012, the National Oral Health Improvement Strategy for Priority Groups, frail older people, people with special care needs, and those who are homeless, was published by the Scottish Government. It recommends action to improve the oral health of older people in care homes.
What is the role of a dental therapist in Caring for Smiles?
They can act as point of contact for care home staff, deliver training, supervision of those undertaking qualifications, help organise dental visits if required, and if so, check with families and social work about exemption and patient advocacy. We can also supervise teams of dental health support workers and dental nurses.
What about a patient's general health?
A dental therapist has a role to promote a healthy and balanced lifestyle to patients attending dental appointments. We can provide smoking cessation and refer the patient when necessary for health issues such as drug and alcohol misuse to the appropriate care and support teams.
Now I know what you mean about dental therapists being part of a multidisciplinary team.
Yes, all healthcare professionals are part of this team and we can all work together to improve patient care. This includes dentists, dental therapists, hygienists, dental nurses, receptionists, general medical practitioners, orthodontists, dental specialists, maxillofacial surgeons, speech and language therapists, nurses, social workers, dietitians, radiographers, head and neck radiologists, occupational therapists, health visitors, psychiatric nurses, nurse practitioners, midwives, and the list goes on.
So, Haley, as a dental therapist, why do you feel it is important for us as dentists to be aware of your role?
I think it's important to be aware of all dental care professionals' roles in Scottish dentistry and how the dental team should work together to provide Scotland with the best possible oral care. Also, working with local communities to achieve a united approach in improving and promoting a better oral health in Scotland and bridging the gap in dental inequalities. We can do this by communicating and educating each other and working together to provide our patients with the best possible care.
Is there anything else you would like to add to this video?
I think that's it from me. I hope this gives the dental students a better understanding on the role of a dental therapist within various dental and healthcare settings and how we can cooperate with other team members to improve patient care.
And cut!